Trauma First Aid is a short-term intervention model versus a therapeutic model. Our focus is the physiology underlying the trauma. So talk therapies are working with the parts of the brain, the neocortex, and some part of the midbrain, which is called the limbic system, which deals with the emotional part of us. We're really working with the lower part of the brain structures that control the autonomic parts, the blood pressure, the heart rate. In trauma, it is necessary to disconnect from ourselves to get through the situation. But when we come out of it, we may stay disconnected. You can't come back to your family very well. You can't find yourself. So in that way, we see, again, this is mind, body, spirit, all of it. We are not one thing. We are the whole thing. In Trauma First Aid, we really recognize that and work with all levels. So Trauma First Aid has kind of two focus places. One is on self-care, that we use the analogy of getting your own oxygen mask on first before helping with someone else. And then there is helping someone else. So we really feel that it is critical to know how to take care of yourself. These skills are not taught in healthcare.
Since having the training, have personally experienced the ability to calm myself during a very high stress situation where I was starting to sweat. My eyes were starting to get tunnel vision, and I recognized that, and I went ahead and used the technique that Jeannie teaches, and amazingly to me, it worked immediately.
Utilizing the TFA techniques, which I do probably 100 times a day, personally and professionally, is really a way of me taking good care of myself in a field that it's imperative that I do that, or I will not be able to work in the healthcare field.
I have one nurse who said that she felt like this was more important than CPR. And I certainly have used it more than CPR in my life. I use it every day or every week.
After Hurricanes Katrina and Rita hit South Louisiana, I was called into service by the Volunteers of America contract to create a stress management program for the first responders and the second-tier responders. So as I was a part of a team developing that program, we were introduced to Jeannie Everett's work, Trauma First Aid, because she and her team went into New Orleans, and we were beautifully able to incorporate the skills and techniques of Trauma First Aid into our stress management program. You know, traditionally speaking, the FEMA program is a psychological first aid program, right? And when we looked at that very quickly in the beginning, we understood as a small team, just a nucleus of 8 practitioners, 8 professionals, that it wasn't good enough. Jeannie's work in Trauma First Aid actually gave us the language and helped us be more concise with the information, and which allowed us to address the needs of thousands and frankly millions. And TFA gave us the language to address the nervous system and the skills then to help stabilize the nervous system, because in most instances we only had one encounter to do our job.
I was invited to Katrina, and we would work with individuals. We would do some trauma first aid sessions and grounding and settling people and letting them know that they're going through it at the same time that they're helping people go through the experience of Katrina. It was very helpful to teach them. One of the parts of it was the self-care of noticing that, boy, I'm really, I'm losing it here, or I'm really tired or overwhelmed or freaking out, whatever it is, so that when they recognized that, they had something right then and there that they could do with that and not have to go home or give up or just not be able to function.
My name is Kim, and I'm a trauma flight nurse, and I work on a helicopter. I use TFA while I'm in the helicopter, prior to having any patients, and I use TFA once I'm with the patients. I find it's an integral piece of what I do as a skill-based practice, and it's become incorporated in everything that I do with my partners, with my patients. It's incredibly valuable.
So I went to National Guard as a medic for 3 years. During that time, I got deployed to Iraq again, and before that, I was teaching the Army medics their job, and now I'm working for a private EMS service in San Antonio. I think I see TFA training for anybody. It's not just the people that I work with, or the patients. TFA training can be used on anybody that is out there. You have to think about it. You talk about EMS workers and patients. What about family disputes? What about people that have issues on the side of the street? Anybody can use it anytime they get upset.
So I was talking about a particular patient who had a horrific trauma, came in, and we label, the intensity of feeling 1 to 10. 1 not feeling very depressed, 10 feeling the most depressed you've ever felt. And so when people come in with PTSD, I try to do the same thing with PTSD. And he said, okay, my PTSD symptoms are 25. And I said, okay, we're starting at 25. And 6 weeks later, and this is a gentleman who could not stop shaking, visibly shaking, all of his limbs, was disassociated, had a really hard time just sitting in his seat. And after 6 weeks, the PTSD was 4. And that was TFA. So when I get them and I name PTSD, has anyone ever said to you about PTSD? They said, oh my gosh, you mean there's a name for it. I'm not crazy. It's like they have hope for the first time, and sometimes for the first time in their lives. And we're talking about people who are, 50, 60, 70 years old with these symptoms that are very disruptive to their lives. Their lives just they don't function well because they are so activated all the time. And it's tragic. And they have something to leave with, and they leave with hope, and they leave with actual tools, which is very TFA oriented.
And the supervisor called. There had been a fight at a bar, and someone got stabbed, and they were trying to get the patient out. They were rocking the ambulance back and forth, and they somehow managed to get the door open, and they had one of the girls was trying to grab her out by the ankle. And so when the supervisor called, though, he had sent them home, and he wanted me to help do something, take care of them, fix it. So I asked one of the girls, I asked her to go and sit in a chair, to put her feet on the floor, to take a deep breath, and we used the trauma first aid process, and what happened was amazing. Okay, I could see it, even though I wasn't there. I could see it because it was so striking. She went from a babbling, incoherent, hysterical woman to a very coherent, very organized, good thoughts. She settled, she switched, she changed channels, she shifted.
And she said, well, they're in the ICU and they bled out and she couldn't focus. And I thought, well, let's just see if we can settle her for a few minutes because she couldn't continue on with her day and take care of the rest of her patients. I did some grounding work with her just to get her back in touch with her body. And then she looked at me all of a sudden and she said, wow, you're magical. And I said, no, I'm not. This is just what we do.
I am able to use TFA almost daily. I say various things, scratches, cuts, broken arms, legs, just anxiety in general. So it's been extremely useful for me, and it works very quickly. It makes my work much more efficient and I have much more time management. I don't have to spend as much time trying to calm students down in the way I learned as a nurse. There was a little guy, he was trying to do backflips off of the jungle gym outside on the monkey bars, and he had broken his arm, and he was in pain, and he was crying and very upset. So as soon as I saw him coming through the door, we immediately started grounding. Got him to calm down, to quit crying, so I could actually do a nurse physical assessment on his arm to see where we needed to go. And so we resourced, we found his happy place, and it was his mom and his dad, and spending family time and playing games together on Friday nights. And long story short, we did have to call EMS to come and transport him to the hospital, but he required no pain medication at that time. He wasn't crying. He was calm and smiling. He was fine. They started an IV and they did their whole thing, and he was cool and calm and collected, and you know, I attribute it all really to TFA and the skills that I learned during that 2 days.